Welcome back. You are still watching Today here on ENCA. Now, the third wave, we've had several warnings there could be an upsurge in COVID-19 cases come the Easter weekend. Several experts have urged government to impose stricter measures over the 4 days. The National Institute of Communicable Diseases, Professor Adrian Puren, speaks to us now. Professor, thank you very much for your time. Now, first of all, do you agree that South Africans need a much stricter level of lockdown as we head to a long weekend?
Well, I think it's all about managing risk. So you're quite right. I think it really looks at what is happening in terms of the current state of the epidemic and then managing those particular risks. And that means looking at government, looking at community leaders, looking at religious leaders, for example, and our community, really assessing risk, engaging with what those figures are telling us, and enforcing what is required in order to manage risk. But I don't think it's a matter of saying that it's a blanket approach. I think that the strategy that was used by the government during the resurgence demonstrates that you can use a differential approach depending on what is happening in each particular scenario.
But also looking at how slowly our government and we've performed as a country in terms of our target to have at least 1 million nurses and doctors inoculated by the end of this month. And of course, we are under 200,000. That also has to do with having to go stricter, doesn't it?
Yes, so you're quite right that, in fact, our ability to reach the number of healthcare workers is really critical. But under those particular constrained circumstances, I think we really then need to really focus around really trying to preserve our healthcare service. And so this is an opportune time again, and because we've had the resurgence plan, it's reinforcing those particular plans in order for us to really try and preserve our healthcare workers as far and as best as possible by instituting, various strategies. For example, as I said, it's about the risk communication. It's again around encouraging people that have symptoms to get themselves tested, to trace and isolate and quarantine those particular individuals. So it's really having those particular programs in place as well as the preparedness of our healthcare system in order to manage not necessarily the inevitable resurgence, but really trying to manage the outbreaks that can certainly occur or continue to occur.
When we reached our second wave, Professor, government was basically criticized, people saying that they should have seen the second wave coming earlier because it coincided with the fact that we also were, in December. We were in December mode and people were not adhering to many of the lockdown regulations. And of course, we know we had a very bleak welcome into 2021. People were expected to stay home. So are we on time this time if government would make it stricter? Shouldn't this have happened a bit earlier?
So we've just essentially our second wave, if you like, we're really just out of that now, except for the Northern Cape. So you're right that it is really critical for us to try and preempt those particular events that are occurring, because what we're looking at, you're quite right, is our history. And what is going to happen over the next few weeks is really going to be critical, but how do we manage that? So you're quite right. Again, I think the South African government, as well as the various important role players, are really trying to see how they can best implement and ensure that we are able to control transmission as best as possible. So yes, we have reached an effective R, if you like, at 1 or maybe less. So how do we sustain that and suppress it further? Is really coming back to the fact that we really need to enforce our risk communication, the physical distancing, the wearing of masks, all those particular activities, as well as limiting, because as you know, these upcoming weeks is where people are really going to be congregating more and more. So how do we limit that and enforce that? And it's really, as you said, the government's role to play that, but all other leadership should really play an important role in terms of minimizing contact, minimizing the physical distancing, enforcing and encouraging the wearing of masks and social distancing. These are really important things to really try and limit and preempt a marked third resurgence.
All right. Thank you very much for your time. That is Professor Adrian Puren from the National Institute of Communicable Diseases.